Hello and welcome to Regina's Corner. My name is Regina Marks and thank you so much for stopping by here. We have a wonderful guest, Yasmina Cheeseman. She is a physician assistant board certified and she's going to be talking about the importance of elderly care and health during this COVID-19. Yasmina, thank you so much for being here today.
Thank you for having me.
Can you please share with the community the importance of geriatric care during this pandemic that we're going through, and anything else that you would like to share with us?
Sure. So first, when it comes to the geriatric population, so referring to anyone above age 65, we need to think about additional risk factors that make them immunocompromised. So what do I mean by that? I just mean that their bodies are not as good at fighting infections like body of a healthy 25-year-old. Now, some of that is natural. As we age, our respiratory capacity changes. Our immune system changes. So some of it we cannot change. We just have to acknowledge that it's there and protect that population some more. Something else that's a factor is by the time we're 65 or older, we've had a lot of wear or tear on our bodies. So maybe we're a smoker. We've smoked for many years. Well, that really impairs the function of the respiratory system. Maybe this patient's been diabetic for a long time. So again, leading to chronic inflammation and immunocompromise. Maybe there are cardiovascular complications. That's another reason why our geriatric population might be more prone to developing the severe symptoms of a virus that might be handled just fine by, again, a healthy 25-year-old.
Yeah.
Wow.
Okay. What other, so in other words, different, let's say for like if you have lupus, that would actually make your immune system more weaker, and then with your age.
Absolutely.
So what can this population do to keep themselves as safe as possible?
Wonderful question. So number one would be to just keep themselves as healthy as possible. So eat well, grab the veggies, grab the fruits, lay off the sugar, do maintenance exercise. Now, I'm not saying run a marathon at 70. Some people do, and I'm so impressed.
Yes.
But, just go for a walk daily, work on that lung function and your capacity. So that's kind of baseline for most diseases, right?
Yes, it is.
Well, of course, there are other things you can do. So, we've heard a lot about restrictions and not going out. So please use caution.
Yes.
Before you go to a crowded grocery store or any kind of a crowded place, right? So this is where we as a community can step in and say, hey, my older aunt, my grandmother needs groceries. Let me go and get them for her and just deliver it.
Yes.
If they do go out, wash the hands. Now, there was a bigger concern initially about contact surfaces. A couple of days ago, a study came out that's saying it's not as much of a risk, but still, any risk is risk. So hand sanitizer, gloves, certainly to be on that extra side of caution. Masks are another thing. So number one reason why people should wear masks is to prevent from spreading their virus to someone else. So, as a healthcare worker, I wear them because I might be asymptomatic. And so if I go out and I'm just breathing 6 feet away, I could pass those viruses and infect you, right?
Mm-hmm.
So a mask, I'm keeping the germs in my mouth. Now, do they fully protect you? If you are a person that doesn't have the infection, do they fully protect you? Sorry. So I don't want to give people a false sense of security, whereas I have this mask, therefore I'll be okay. That's not true. You can still get it, but it certainly decreases amount of viral load, so the amount of viruses that you can inhale if you have a barrier, especially if it's a quality mask and if you're wearing it appropriately. So make sure that, it is tightly pinched on your nose. I mean, don't cause skin issues, but make
Right.
sure there's a nice seal. What works best is if you have kind of 2 points of securement. So you're securing up here and then the ones at the bottom, because you want to lock in kind of the base of your jaw. So that will just overall decrease anything you may inhale. And of course, at any onset of symptoms, I would highly encourage you to contact your medical provider. What we've seen is people can decline very quickly. So don't wait until you are absolutely struggling to breathe and you cannot move and you're turning blue. That's advanced. I would say if you start developing fever, you start feeling achy. Some people are saying initially it's just kind of like a tickle in the throat with some shortness of breath, but then eventually they just become more and more short of breath. Please call your provider.
Absolutely.
Telehealth medicine has exploded. I've been really lucky. My practice incorporated because they didn't want us as providers to spread or attain the virus. So don't hesitate to call and talk to someone. And we have an algorithm. We have specific questions that we can ask to see, okay, what do we need to do here?
Absolutely. Wow. Yeah. Can you also share with us a little bit more of how family can help? Because sometimes you have those elderly. I know I have an aunt and she is independent. So what can we do again to help keep them safe?
Absolutely. So if they are willing to receiving our help, we'll be lucky enough where we'll get a grocery list.
Right.
Not just take initiative, take initiative, do the basic shopping for them. And again, even when you drop it off, be careful, make sure that you, the healthy person, you might have the virus and not know it. You need to wear the mask so that you don't pass it on if you have it. Drop it off at their doors, step back and say here, they will appreciate it, even if they're Mr. Independence.
Yeah.
Something else we can do is just kind of in casual conversation, ask about symptoms. Hey, are you having some fever? How are you feeling? We know what their baseline is. And so they might not be aware of the fact that they're declining and they're struggling, but we can catch that and certainly encourage them to seek help. Yeah. And something else, something that's been really heavy on my heart is patients who are in isolation, patients who are in nursing homes, who now cannot see their family members. Now, that's a protective measure. We have to do that. But the psychological part of this has been so heartbreaking because we all need human interaction. We all need to have that touch and know that we're loved. So biggest thing we can do is call them frequently. Skype, if they know how, Skype. If they are, if they have dementia and they are not self-sustainable, go to their window. That's a perfect barrier.
Yes.
Really makes a huge difference for them to have that interaction instead of just, kind of feeling like they're cut off. Again, especially the memory impairment, they don't know, they don't remember that there's a pandemic right now. They just feel forgotten in a way.
Absolutely.
Yeah, and I've certainly watched some of them honestly just decline. So that would be a major thing that we can do is just show our love, support, call them, visit them any way we can, of course, practicing good measures so that we're not infecting them.
That's true. I have a sister who is, we're 10 years and 3 months apart. So she is geriatric age and she lives out of town and she is in like a It's a home for the elderly, but yet and still she needs a lot of assistance. And we have other family members there. So I've been calling her, and she likes to hear me sing over the phone. And one thing that she said to me, she says, "I feel like I'm in prison because they're
Yeah.
not able to go out into the dining area like they used to eat
Yes.
and to play
Mhm.
games." And so, like you said, she doesn't really have that contact. So everything's in her room. She's eating in her room. And though she has a
Yeah.
television, we're not able to come and see her. And our family that lives there are not able to come and see her too. So I call her quite often, and just to talk about things. And
Yeah.
my grandchildren, what they do for us is, because they're all tech savvy, and they will send like little videos with little signs and that sort of thing. So that's
Mhm.
something also you can do for your family. Maybe somebody there can help with the phone or something. Maybe they don't have a cell phone,
Yes.
but just to call them,
Mhm.
to talk and to update them on maybe funny things that's happened, that sort of thing.
Mhm.
Or if they do have a cell phone and they know how to use it, you can send pictures, you can send little snaps of video. I'm not sure, maybe some of them do know how to use Marco Polo. I know that we're doing a lot with that with our families, and just
Yes.
that I did not realize even the just the power, like what you said, of human touch and human contact.
Yes.
Even just when you came on there, I was like, Yasmina, you know what I mean? Like, I haven't seen you in a long time. And you realize the joy that you get with the human contact. So there's this
Mhm.
all kind of things you can do, to, like you said, I mean, like I just got through saying, draw little pictures, hold them up. We love
Yes.
you. You know what I'm
Yeah.
saying? Yeah.
Oh,
Yeah.
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 That's
It's so
wonderful.
true.
I'm glad you added all that. Absolutely. I'm glad you mentioned music. Music is a beautiful thing. It really can impact us. So yeah, suggesting for them, certain playlists or singing. You have a beautiful voice. They would not want me to sing, but I'll leave that up to you. Getting the grandbabies to sing.
I,
My gosh.
I know it. It's so cute. It's so
Yes.
cute. My grandbaby sent a video yesterday, and one of them, because I gave them my old karaoke machine. I've had a karaoke machine for so long. Well, we were doing some other things, and so we were cleaning out some areas, and I was like, give them this karaoke. Well, they called back. Somebody was on the drums, and somebody else was on and I don't know what they were saying. I don't know what my little baby was saying, grandbaby. She was just going at it, but the joy that you
Yes.
feel regardless of of
Yeah.
that can be a healing within itself.
Oh,
So
absolutely.
thank you for saying that. And also, a sneaky way they can also find out if you're okay, you know
Yes. Absolutely. Absolutely. Yeah.
Oh,
Find out how they're doing and give them some positive news. Anything positive. Oh, hey, the weather's getting nicer.
yeah,
Things in life.
yeah, that is so true, absolutely.
Mhm.
Yasmina, is there anything else that we want to let our community know?
I would say this is a good start. Just keeping yourselves healthy, remembering that we are all in this together, that this is a time for us to step up to the plate and support those who need us. So don't be afraid to roll up your sleeves and support each other in any ways that we can. Um, and just we'll get through this.
That's so true.
Yeah.
That's so true. I don't know if it's a okay thing to mention. So, by you being a healthcare provider, what about making sure that people are drinking water? So, I want to tell you something I didn't tell you, because I love to make this as natural as possible. So, I
Yeah.
didn't realize that I had dehydrated. So, my husband and I were cooking breakfast together,
Yeah.
and I fainted. I mean, I just went right down. And so, well, I didn't like completely go out, but things started getting dark and I went down. And
Mhm.
so we ended up calling the paramedics, and I was dehydrated. So, can you just touch on a little area? I know some people might be limited to fluids, but those that aren't, the
Right.
importance of drinking plenty of water during this pandemic.
Oh my gosh. Yes. 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 I'm gonna raise the roof with this one. That's so
Okay, do it, girl.
So first of all, I'm really sorry you fainted. That sounds scary, but that happens more often than we think. Yeah, good for you.
I got Gatorade too, so I'm good.
Yeah, wonderful. So unless you have some kind of a severe heart problem where you're placed on fluid restriction, really water is your best friend. And I want to separate water from coffee and teas and definitely, soda pops. Most of our body is water and we need it. Water helps with our blood pressure, which, if that's really low, we can, faint. Water helps with our kidney function, helps kind of clear things out. I mean, it's just essential that we keep an adequate amount of fluid. So there are different ways that we encourage people to do that. Some people do really well if we get them like a really big jug. It's, 2 liters.
Yeah.
It kind of has, okay, by noon, you should be at this point.
Yeah.
If that works for you, great. If not, then just surround yourself. There you go. You're just wonderful example with water bottles, water cups. I mean, that's a huge thing. That's a huge thing because if you are dehydrated, then you're just predisposing yourself to more complications.
Absolutely.
Yeah.
Absolutely. So
I'm so glad you brought that up. Yeah.
Yeah. Well, and I guess I don't know. And I dehydrate. I don't know. I've had that to happen to me before. And actually, when I was looking at my skin, I did like this. I said, I think I'm dehydrated. And I'm going to be honest on here. I'm going to be transparent. I was like, I think I'm dehydrated. And I ignored it. So you guys don't ignore that. I ignored it. I thought I'm going to be okay. And then the next thing you know, I'm going down to the floor.
Yeah.
And and so I wanted to wait, but then we had to call the paramedics. But anyway, that is so true because then you, like you said, you have risk factors for everything else. So even if you don't like it, you want to just drink. In other words, and like you said, unless you have some health restrictions, to drink plenty of fluids.
Yeah, and if you don't like the taste of water, so my wonderful grandmother, may she rest in peace, she did not like water. And we had a terrible time. So maybe consider some natural flavors. I'm not saying, get all kinds of fake flavors and chemicals into your body, but maybe a little squirt of lemon, some chopped up strawberries, mint, changes the taste, makes it more juice-like, and refreshes cucumbers, and you feel fancy.
Okay, yeah, I'm gonna try that. I mean, I've done the lemon thing, but now you've actually added on a little bit more. Okay.
Yeah.
Maybe you want to just slice it on the little side of your little glass, make it look all cute.
Little things in life.
Drink water. Yeah. What kind of exercise can people do in the house? Let's just say if you're pretty much restricted, so you're sitting down. What can you do to get that oxygen and that blood flow from a sitting down position?
From a sitting down position. Okay, well, you did a great demonstration. You used your arms, right?
Yeah.
So, gentle stretching, moving things up and down. If they have gentle weights, or get creative, some kind of object you have in the house, as you're sitting down, making sure that you are able to inhale enough oxygen as you're doing this, and then lifting it up and down and side to side. Wonderful thing that I recommend for most of my geriatrics is to get some kind of it doesn't have to be a stationary bike, but they have those little, pedals. And so you're sitting down, you're watching TV, but you're gently pedaling.
Right.
They're good post-operatively, and they're good to just keep that blood flow going. So I love those. We definitely got that for my grandmother when she was around, just to support that exercise. And then gentle ambulation. So just, if the house allows, kind of walking around doing circles.
Absolutely. Yeah.
If they are able to go up and down the stairs, now be careful. If you've fallen before and you're feeling dizzy, unstable, please don't go up and down the stairs. But if you can, that is a great aerobic exercise. Hold on to the rail, nice and slow. That will really get your heart pumping. Go up and down a couple of times. You're tired, sit down, do something else. 2 hours later, do it again. Mm-hmm. It's free exercise in your own house.
Yeah. When you said objects, I thought about maybe if you're physically able to do that,
Yeah.
maybe a can of beans or a can of something like cans.
Yeah. Yeah.
Use those,
Yeah.
because I used to do that.
Juices. You know those big V8 juice
I
bottles?
needed exercise. Right. So we won't get on me.
No, we won't.
Pandemic pounds, as they call it. You're
Oh,
eating more. You're eating more at home. And so I guess I'm using that as an excuse. So, but I am going to go walking. I am going to start walking. So
absolutely. Yeah. Especially if we are blessed to be in a neighborhood where there are lots of paths. And again, you're not in a crowded situation.
right.
Where people, walking right by you. Oh, please, that's the best thing. If you can leave the house, do. Because then you get sunshine. That helps with vitamin D. That helps with, again, the mental component of it.
Right.
You're fresh air, just so many benefits.
Yeah.
I get everybody out. I force my child out, the dogs, everybody. Yeah.
I just want to thank you so much for taking time out just to talk to us. Yeah. And we're going to be able to do some more things too. I want to do some more things with you as well. Any information that we can get out to the community here to let them know how to be healthy. Is there anything else that you would like to share with us? And before we just kind of come to an end here,
just love each other, support each other. That's what we need to do.
Yeah. That is so true.
And thank you for this opportunity.
What's my word, opportunity? That is so true. That is so true. I like the colors in your house. They look similar to my colors.
Thank you.
I know.
It was pre-painted when we moved in, so I'm not much of a...
Oh, okay. That's all right. Again, Yasmina, thank you so very much. And I look forward to talking to you soon and us actually doing another segment of how to be able to stay healthy.
Yeah, wonderful.
Thank you so much and have a good day. And I'll talk to you soon. Thank you also, everyone that stopped by to listen. If you have any questions, please leave your comments and I'll pass them on to Yasmina. Please remember to subscribe, hit the bell. And what else do I want you to do? I want you to subscribe, hit the bell, and hit like. Yes. All right. We'll see you soon on Regina's Corner. Thank you and have a great day.
All right. Bye-bye.
Bye-bye.